So, what exactly are AVMs? AVMs are AV malformations. These are entangled abnormal blood vessels between arteries and veins inside the brain. They disrupt the normal flow of blood in the brain. They can sometimes bleed and cause symptoms depending on the location. The most common presenting symptoms is headache. They can also present with neurological deficits based on the location of the bleed, like weakness of the hand, weakness of the leg, visual disturbances, hearing loss. Whatever be the presenting symptom, the patient needs to be managed immediately, and effective management depends on timely management of the patient. So, timely in the sense, if the patient presented with emergency bleed like a stroke, hemorrhagic stroke or an ischemic stroke, whatever be the presentation, patient needs to be managed immediately. What are the management options available? Depending on the presentation symptoms, the time of the presentation, the patient can be managed either with close observation, surgical excision of the AV malformation, stereotactic radiosurgery and embolization. Whatever be the treatment option, the patient shall be managed effectively if the patient is brought in time to the treating neurosurgeon. So, what are the treatment options available for AV malformation? This depends on the size of the AV malformation, the location and the patient's overall condition. So, based on these factors, the treating neurosurgeon will decide what option is the best for the patient at the time of presentation. Some AV malformation can be just monitored by close observation. Some of them definitely require surgical excision. Some of them can be managed effectively just by embolization, which is an endovascular approach. Following surgical excision or stereotactic radiosurgical excision or embolization of the AV malformation, some patients with AV malformation can have residual neurological deficits, as in weakness of the hand, weakness of the leg, speech disturbances based on the location, while some of them can come out of it without absolutely no deficit. So, whatever be the condition of the patient at the end of the treatment, the patient either requires rehabilitation and regular follow-up. Some patients can even have disturbances with vision. So, all these things can be managed by the neuro rehabilitation team, and of course, the patient needs to be in regular follow-up to know if the AV malformation has progressed or it has receded in size following stereotactic radiosurgery. In conclusion, majority of the patients with AV malformations get back to near normal routine life as they were prior to the presentation.